Okay. Hello everyone. Welcome to YouTube channel Health Q, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. I am back again with this live video session with Dr. Ashwani, and I am super excited for today's conversation because it's around one of the most talked topic on our channel, and that is facial paralysis. Facial paralysis has got highest number of views, highest number of comments, and highest number of videos as well on our channel. So I believe today's video is going to be very helpful for all the people who are suffering from facial paralysis. So if you who are stumbled up right now on this live video session, and if you are someone who has gone through facial paralysis, make sure to stay tuned throughout this entire live streaming, because you can ask your questions live here regarding your facial palsy, your Bell's palsy, in terms of how diet, how nutrition, how functional medicine can help you to reverse this condition. So, thank you so much for being there and welcome, doctor. Thank you so much for accepting our invite and being again with us on a most talked topic on our channel, and that is facial paralysis. Thank you so much.
Thank you so much, Meghna. So, hope I'll be useful to the people
Yes,
who are listening.
absolutely. You're going to be. I can tell how many people are waiting for this. So, just I would like to give you a quick context on what we talk about on facial paralysis on this channel. So, facial paralysis, as I said, is one of the most talked topic in our channel, and there are a lot of people who suffer from it. So, if we look at the data, 3 lakh people every year suffer from facial paralysis, and globally, India being the third largest country when it comes to the prevalence of facial paralysis. The second thing is facial paralysis, Bell's palsy in general can happen at any age group, starting from childhood to mid age to older age, and viral infections are one of the major or leading cause for facial paralysis. Apart from that, if a person develops tumor or stroke, even at that time, the person is prone to develop facial paralysis, and there are a lot of factors that impact the recovery, and there is a lot of misconception, there's a lot of problems that people face in the recovery process, and I believe your information, your expertise can help in a lot of ways to help this patient come out of it. So,
All right.
with that point, I would like to start off with my first question to you, and that is, according to you, what is the role of functional medicine when it comes to viral condition or viral disorders?
Right. So, I think one fact we have to live with is these viruses are always with us, around us, within us. Okay. They're never going anywhere. So, only thing that can protect us is our immune system. If our immune system is working well, we are protected. And if it has a problem, this is where these viral infections can overtake us, override us, and they can cause different problems. And Bell's palsy is one of the problems. Now, there could be a lot of issues which can cause immune dysfunction. Okay, as simple as if we are not giving the raw materials to the body needs enough fats, proteins, minerals, and vitamins. As simple as that. If we are not feeding ourselves or not digesting the food, that can give less raw materials and poor immune system. So we might have seen a lot of cases where people have taken a vaccine but they don't make antibodies. That has happened with the COVID vaccine. Vaccine is a different story, but at least from the standpoint of view of understanding how important is the immune system. So raw materials is one, digestion is another one. Somebody should be digesting their food so that food can become a part of their. So sometimes even they don't eat healthy or they don't digest. Both are problems. Now, immune system, the driver behind the immune system is the microbes in the gut. The trillions of microbes could be uh, uh, viruses themselves, could be fungi, could be bacteria, could be parasites. Now, if they're in the right balance, then we have a good immune system. Now, if these microbes in the digestive system has gone haywire, that means we have a lot of chronic infections. Then our immune system start becoming weakened and weakened and weakened. This is where the problem becomes more. Now, if we don't follow the circadian rhythm, that is when we get up, we don't see the sun, and when we are in the evenings, we are always under the tube lights, LED lights. Now, that also disrupts the balance within the body, makes the immune system weaken. This is where our tendency to get a poor immune system, thereby more infection becomes prevalent. And of course, the Wi-Fi's and non-native electromagnetic fields from the various human-made devices. So that's another sort of a pain point where, as that technology experience is increasing, probably we are becoming weakened and weakened. Probably this is where we are more prone to the problem. Now, if we start addressing these things one by one, then we are more, we can fight the infection in much better way. Or even though these infections are there, these microbes are there, these viruses are there, they'll not be able to attack us. Uh, Another reason that I want to mention here is which is weakening our immune system is the use of the paracetamol. So we are seeing a lot of people have chronic infection, lot of them, lot of us. Now, fever is a supportive role. Fever is a positive thing by the body. When there are infection, you raise your body temperature, you kill those infections. Now, when you take paracetamol, you stop that response of the body to kill the infections. Now, the fever is gone by the antibiotics, but your infections are not gone. And most of the antivirals are not so effective per se. Uh, so those are some of the things which people should be taking care.
Awesome. That's very insightful. So now coming to the three most common questions that people ask, especially when it comes to Bell's palsy or facial paralysis, that is, it comes under your ENT infections, right? Your ear, nose, throat infections, where the infections are so common. Why viruses attack these areas so frequently or so easily than rest of the other body areas?
No, I think that's a misconception. And when we start compartmentalizing the body,
Okay,
this is ENT, this.
right,
A lot of people get a lot of frequent colds and coughs.
right,
That's also viral infection most of the time. People get a lot of stomach issues. Even in the COVID, people had a lot of stomach issues. That is
right,
also viral infection. Then, when body you ignore all of these things. Let's say running nose, you ignore. Let's say a diarrhea, you ignore. Let's say cough, you ignore. And that means body is becoming weakened and weakened. Eventually, is comes to the point where it start attacking most important crucial organs of the body. So if we if we stop compartmentalizing the body and we look at the body as a whole, then and you start connecting the dots, you will see a lot of prior problems where your body has tried to give you a lot of clues that things are not right. Probably we missed that train.
right, right. So, what are these clues? If you can share that, some of the clues that people should look out for, which are the red alert sign, or maybe clues that can suggest that the body's immune system is going weaker.
So, like I said, immune system is being controlled by the microbes in the gut. If somebody has constipation, somebody has bloating, somebody has GERD, somebody is on the antacids, uh, somebody has IBS, IBD, that basically means the digestive system or the microbes in the digestive system is not healthy.
Okay,
And that's a starting point. Then that's a basic thing that you can consider that your immune system is weakened or is going to be weak because you have the digestive health problems. Now, if somebody gets a frequent cough and cold, sneezing in the morning, okay, uh, basic issues, frequent, sometimes a lot of people we see they have a mild raised body temperature.
yeah,
They don't have full blown fever, but they have a sense of this thing. Then they go to doctor. They say, "Oh no, their temperature is absolutely fine, nothing to worry." But if
correct.
you look at your reports, CBC, your lymphocytes remain high. Rest of the parameters are all fine.
Hmm.
That means there is some level of chronic infection going on. If chronic infections are there, that means your immune system cannot fight them. That means your system is weakened.
Right, right. And how to address this? If let's say if somebody wants to start acting fast on these signs and want to prevent these kind of disorders coming in future, how what are the lifestyle changes that can help a person to prevent it?
So I think first
Basic.
of all, uh, uh, the basic is to keep your digestive system healthy. Don't overeat. Okay, at least eat as much as you need. Don't have multiple meals a day. Okay.
Okay.
Don't do a lot of snacking. Eat early. First meal of the day or last meal of the day should be early. Go with the sun. When the sun goes up, you take your first meal. When before goes down, or just right after that, or 7:30, you have your last meal. That's the first thing. Then chew your meal thoroughly. Then, of course, eliminate sugars. A lot of dairy products that are available in India are coming from the lot of adulteration products. So you want to avoid that. Wheat is another which major problem today because of the hybrid nature. It does make the immune system very, very weak.
Okay.
White rice is another common thing. I think probably it's very difficult for people to cut down on the white rice, but at least if you can start switching to more unrefined rice. Soya mali is a one variety of rice which can be taken, which has a low glycemic index. By the way, the food should have enough protein and fats. At least if the basics can be done, lot of this issue, probably Wells palsy, can be prevented, or other problems, lifestyle problems, can also be prevented.
Mm.
And most of the chronic problems that our society is going through are lifestyle problems. They are not genetic problems.
Right, right, absolutely. So, coming back to Bell's palsy, let's say someone who has developed Bell's palsy from a viral cause. What are the key things the person can start immediately acting on to reduce that viral load from the body? Because viral load is so high that it takes time and it also impacts the recovery for the person.
Yeah. So I think there are two things that are there. One is controlling the infection of the viruses or any other infections. Another one is supporting the nerve health. Right.
Okay,
So these nerves are inflamed,
right.
and inflamed nerves are not functioning. This is where the problem has come to the system. So if we have to support the nerve health, now 75% of the brain is simply fat and 25% is protein. You should include more fat and proteins to diet. Take more omega-3 fatty acids.
Okay.
Okay, that can be fish oil, that can be algae oil. Then there are special mitochondrial supplements like carnitine, B complex, good quality methylcobalamin, methylfolate, and other parts of the complex. Then the special mitochondrial supplements like carnitine, D-ribose, CQ10. And these are some of the things, of course, we can test them what is missing in the body, or as a precautionary measure, they can start it themselves also. Now these nutraceuticals you can pick out from Amazon also.
Mhm.
So yes, it's a good idea that you are consulting your doctor, but on a safer side, you can minimal dosing. You can do it yourself. So supporting the nerve health is one thing. Then of course, building up your immune system. If somebody start fasting, if in Ayurveda we always said that when you are feverish or you have fever, please stop eating. This is a time when body will start cleansing, body will start repairing when you don't eat. So if you have this Bell's palsy, stop eating. Start doing a water fasting once a week. Okay,
Okay.
this will remove a lot of debris from the body and give the immune system the boost to fight these infections.
Mm.
Get more sunlight, morning sun, evening sun. Sun is always good. Any time of the day, sun is good.
Mhm.
And sleep at time. So body follows the circadian rhythm. That is when the light is falling onto the skin, it gets the signal that it is a daytime and it is time to metabolize. When no light is falling, when we are sitting in dark, when sun sets, now tube lights, if they're on after sunset, I'm still getting a signal that I have to be metabolically active. Now
Mhm.
that's a mismatch. Now, if we stop that, we start sleeping at time. By 10 o'clock, you're asleep, and it's dark, pitch dark in your room. Then your cells don't get a signal to be metabolically active. This is where the body will start repairing.
Mm.
Then probably a faster recovery can happen.
Right, awesome. And sir, I would like to take this a little more further. So, again, according to the data, 95% of people recover from Bell's palsy in the 90 days of time frame, 3 months of time frame, with the help of regular medication, and the inflammation comes under control with that. But again, this 5% of people who are left with residuals, or else a chronic or delayed recovery, let's say like we have a Vikas who has also commented that it has been more than 9.5 months for me, still can't smile fully, pucker, raise eyebrows. When would these movements come back? So there are a lot of patients who experience a very similar problem, don't recover at all. And the pattern which I have observed during my practice is they frequently get some sort of infections again and again. It could be in the form of cough. It could be sometimes fungal infection. It could be sometimes little, maybe a viral attack with little rashes, right? So definitely there is involvement of virus infection again, which is not going back. So what can be done for the people who are going through this chronic phase? What is the possibility for them?
It's like we discussed, we have to support the nerve health,
Hmm.
and we also has to support the immune system. Now, if infections are on, then it's just like, we are rebuilding the house, and the rain is demolishing.
Right.
It's just a simultaneous process. You
Yeah.
first has to stop the rain, then you rebuild your house. Okay. So it is important that we thoroughly investigate, look at the nutrition, look at the toxins, look at their organ function, look at the microbiome. So thoroughly evaluate and see where their situation is. Accordingly, we do infection control, we do probiotics, we do detoxification, we do liver cleansing, we do nourishment.
Hmm.
Okay. And of course, the lifestyle and the food change in a very, very, you cannot take it lightly. you know
Hmm.
I think sometimes people do the all expensive things, but they take the lifestyle and the food in a very lighter way. So that should not happen. Another thing that is always missing in the treatment, generally treatment is given as a corticosteroids along
Yeah.
with a little bit of supplements.
Right.
Okay. But now, if you have to rebuild your nerve health, whatever the damage done by the viruses or the inflammation, if you rebuild, you have to give the raw materials. All the, like I said, lot of fatty acids are there within the nerves. The
Hmm.
myelin sheath is fatty acids. So you
Right.
have to feed yourself with lot of healthy fats. Now you can take lot of soaked walnuts, almonds.
Hmm.
If anybody is an egg eater, they can, organic eggs will have lots of phospholipids within them, so they can take that. Anybody is a chicken eater, they can eat a lot of. But it's also important that they are digesting it.
Hmm.
So if they're not digesting it, then it becomes a bigger problem. So I think little more careful planning for them will. We we all working with the brain problems which are otherwise are very hard to resolve. But with
Correct.
very concentrated approach, working with these people will help them recover much faster.
Right, right. And what according to you, stress has a role in all of these things? Because I think stress is also one of the major roles. Because there was one study which said, like, when a person loses its ability to smile, they also lose their ability to feel happy, and that adds up to the stress, and that impacts their mental health as well. So, is there any way through functional medicine that can help to improve their stress levels as well?
Right. So there are two things. Yes, when somebody is stressed out, their immune system is down regulated. As a consequence, infections will start becoming more aggressive. So stress will definitely put you at a risk of the Bell's palsy.
Mm-hmm.
Now, how do we tackle the stress? That it's like you have a Maruti car. You put 10 people on the top of it. Now, this car is not designed to handle 10 people, and that's a stress. Okay. Now, as we are aging, our bodies are becoming weakened. We are not taking care of our physical bodies. Okay. So if we at least strengthen our physical bodies, the physical cellular function within the body, we strengthen that part, ability to handle the stress will improve. Now, we improve our lifestyle, if we improve our nutrition, if we improve our detoxification, if we improve our digestive health, our ability to handle stress will improve. As a consequence, the negative effects of the stress will be less. Now, stress could be mental also. Stress could be physical also. Now, in the physical, toxins are a stress. All the chemicals in the food chain, there are stress. Uh, Tube lights are a stress. Wi-Fi is a stress. Okay, so at least the physical stress, if we can reduce, you will be able to handle better the mental health as well. Now, if somebody is depressive, somebody has anxiety, it's not always because of the mental problems. It is purely can be biological problem. There are imbalances, biological imbalances in the body, which creates imbalance in the brain. As a consequence, depression, as a consequence anxiety. So at least we can easily take care of the physical part of the body. Now when it comes to non-physical part, where mental stress plays a role, then of course some pranayama, some yogic practices, and somebody can visit a guru. those, those are very very established techniques, at least in India, but these are a little more difficult, and somebody needs enough time to sort of develop hang on that. At least the physical part of the body, if we take care of that in a good way,
Mhm.
most of the problems are taken care of.
Right, right. And what, according to you, is the prognosis? Can we improve the prognosis of Bell's palsy recovery with the help of practicing functional medicine, at least from the point where they develop facial paralysis or Bell's
Well,
palsy?
so if in a regular practice, let's say somebody takes 9 months, we can definitely bring it to, let's say, 9 weeks.
Hmm.
So we
Right,
just supporting the, see, we are cutting down the root cause. We are eliminating the issues within the body, and body is constantly remaking.
hmm.
We are constantly making new cells. It just needs the right environment. Now, if we create
Hmm.
the right environment within the system,
Hmm.
if somebody takes 6 weeks, probably 6 days, we can bring that change. If the person is willing to do that, these
Right,
changes are not easy to do that.
right,
People are always scared of changing their white rice to something healthy. But if
right.
they're willing, certainly a lot of changes can be brought down.
Right. So let's read out some questions which are there for us. So Sunil is asking, what are the causes of synkinesis and facial paralysis? So would you like to go, or I can take this question for him? Uh, Whatever is fine with you.
I think basics are covered.
Right. Yeah. So I'll just
Either
like to. Yeah. Please go ahead. No problem.
either like said, it could be a acute infection which has led to the problem where nerve got inflamed, and then as a result, or sometimes I think before the call we were discussing as a stroke, where some
Right.
level of damage to the tissue which has led to it.
Right. So again, I'll just like to quickly give a answer to this question, because this is more of a mechanical standpoint thing. So synkinesis is an habit that your brain forms because your facial muscles are weak, right? So when your facial muscles are not moving, what happens is the face tries all its possible way to make that movement happen. Okay, so let's say whenever you are trying to smile, but your face smile muscles are not strong enough to lift that muscle up, what it starts doing is it starts taking help from the muscles around your eyes to finish that task. And that becomes, for a very chronic period of time, if you keep on doing that same thing again and again, it becomes a chronic habit. That's what exactly turns up into synkinesis. So I hope, Sunil, I was able to answer your question. I'd like to take the second question, which is from Vikas, and that is, for how long does the nerve keep on regenerating in long term recovery? Does it stop after a year? So I think the what he means is, what is the duration? Does the nerve recovery stop or not?
Okay, so see, every 6 days we get a new stomach lining. Every 2 months we get a new liver. Uh, we get new retinal cells every 24 hours. Similarly, nervous system can take complete recovery can happen in 9 months or 1 year. Okay. Now, body is designed to be healthy. Body is not designed to be unhealthy. Body, that's an innate ability that we all born with. Now, if we keep damaging, body tries to keep recovering it. But sometimes the damages have become so much so that there's this sclerosis, is this fibrotic tissue. Then probably recovery is much tougher. But most of the cases that we work with, 90% of the cases or 95% of the cases, where brain, otherwise those problems would have been called as a difficult problems to solve or lifelong problems to solve, we are seeing a great recovery, or people are becoming normal. It's just a willingness of the person, and of course, what you think is going to manifest. So if somebody is on the journey to become healthy, they should be very very positive about the treatment, whatever they are undergoing through, because rest is just a story. It's the mind, that is manifesting as a physicality.
Absolutely, absolutely. I would also like to put a little light on the role of hypertension and diabetes in the process of recovery from facial paralysis. Like sometimes stroke can also happen and could lead to facial paralysis, and sometimes hypertension and diabetes could be the cause of behind Bell's palsy as well. So, how functional medicine can help to bring these two things under control?
Okay, let's talk about this hypertension. Hypertension could be two problems. One, increased volume and blood volume. Let's simply put, as a consequence, there's an extra pressure on the artery. As a consequence, this hypertension, as a diagnosed problem. Another issue is this not increased volume; it's a brittleness of the artery. The arteries have become brittle, so they cannot hold the pressure, or they cannot relax and contract as it should be doing as a healthy person. So then also they cannot handle so much pressure. Then also that becomes a problem. Now, second is the majority case. So most of the time, people are told to not to take sodium or salt when they are hypertensive. So which is a flawed. You don't take salt, you reduce your blood volume, but you make your vessels more brittle. So bringing a ionic balance in the body is very, very required to be having vessels which are more flexible. Now, when you don't have enough sodium, which we see a lot of cases, people are hypertensive and their sodium becomes low in the intracellular space. Now, when sodium becomes low, calcium increases in the intercellular space. So, ratio of the sodium to calcium is disrupted. As a consequence, calcium is deposited in the intercellular space of the vessels. As a consequence, vessel becomes more rigid, more brittle. So, and those vessels can burst easily. So, instead of just following advice saying you stop this or that, you evaluate yourself, see what is wrong, what exactly is it. A high sodium is your problem, or low sodium is your problem, or high calcium is your problem, or low calcium is your problem, or other minerals or other nutrient and imbalances. So if we knowingly do things after thorough evaluation, probably we can easily bring the flexibility to the vessels. Now, if the vessels are more flexible, it can hold pressure as it's supposed to be. Then there are probably the tendency for them to bust in the brain will be much much less. Uh, Now, diabetes is a similar situation where we are forcefully trying to control blood sugars. Now, diabetes. Let's take example of a car. You have a fuel tank. You have an engine. Now, if your engine is not working, your fuel will never be consumed. Now, it's like you drain the fuel tank somehow. It's like, forcefully bringing down blood sugars is what we are doing as a diabetes management. Now, you need to make sure your engines are working so that it can consume your blood sugars. That's a cell health mitochondria within this uh, the cell. Every cell has 5,000 to 15,000 mitochondria. Now, brain cell has the highest number, almost because it's the most active organ, so it is consuming a lot of energy. Now, our goal is to make the mitochondria healthy so that it can consume the sugars that they are into the blood, and it is metabolically active. As a consequence, the brain health will be very, very good. As a consequence, any such incident which generally happening will significantly will reduce, or probably will not happen if you are metabolically healthy.
Mhm. Right. So, if let's say if a person is having these conditions, pre-existing conditions, and on top of it develops a facial paralysis or Bell's palsy due to a viral attack or all, how should be the approach, or how that person can go through this entire process or journey of functional medicine and can take this process, because again it's about lifestyle change, right? And it has something that has to be sustained over a period of time. It's not like a short duration you change that you do and then go back to your normal. So can you just put some light on that?
So how we do it for everybody doesn't matter what is the problem, what is the label they come to us with, either diabetes or palsy or autism or depression or anxiety or IBS. Anybody comes to us, we do two things: we capture all their bodily problems. How are they feeling? what are the symptoms and signs in the body in a very, very thorough detail, so that we look at the body as a complete. Then we do thorough investigations. We look at their nutrition, we look at their organ function, thyroid function, liver function, lipid profile. We look at their inflammatory markers. We look at their toxins. Toxins are another major problem, especially for metabolism and for brain health or nerve health. So mercury, arsenic, lead, cadmium, strontium, uranium, barium, all these heavy metals. So we thoroughly investigate. We look at the infections as well. Of course, depending on the condition, probably we go a little deeper into the infection. What viral infections are there? Probably if somebody comes with a Bell's palsy. So we thoroughly evaluate. Then gradually, step by step, we start focusing on the lifestyle. We start focusing on to the food part. We start focusing on to the digestive health. We start focusing on liver and thyroid function. Slowly uplift their nutrition status. Slowly detox their heavy metals. So gradually, step by step, we keep making their body healthy. As a consequence, the nervous system, as a consequence, the brain health, as a consequence, the nerves start becoming healthier and healthier, and the whatever the recovery has to happen is start. The process starts like that. But yes, it's not a you come in and do it for a few days and you go. Then it's a waste of money and time. You have to learn to be at least till the time you make your recovery complete, probably 3 months, 6 months, 9 months, depending on severity. You are very, very strict. After that, at least you stick to the 80% of the basic lifestyle and the food, and it's not difficult. It just you replace your white rice with a rice which is more healthy for us. You replace your roti with a more healthier grain. You don't eat multiple meals. You don't load yourself with the sugars. You don't eat unnecessary ice creams and candies and colas. So sometimes things are much simpler if you look at that way. But yes, somebody has to be committed to themselves if they want to do it.
Another question that I would like to ask you is we definitely spoke about certain foods like sugar and all those things has to be avoided. But are there any particular foods, especially which are should like absolutely be a no for someone who has gone through a nerve inflammation or any kind of viral infection that can increase the risk or damage that further?
So what we have realized is anybody with the viral infections, they always have some part of fungal infections.
Okay.
Fungus is a case where which will down regulate your immune system too much. This is where the possibility of the viral infections to become more aggressive in your system.
Okay.
Now, if somebody has, let's say, itching, somebody has bloating after eating white rice, somebody has some brain fog, they cannot think straight, or they're always tired in the brain, or tired as a body in general also. Those things are there, then certainly there are, or itchiness, or psoriasis, or eczema. Uh, in such situation, then there is a possibility of a fungal infection, and if that is there, we eliminate all forms of sugars, no jaggery, no honey. In fact, we also eliminate bananas and apples. Otherwise, oranges. They seems to be healthier form of the food. But in this situation, at least till the time this person makes a full-time recovery, we want to avoid these this thing. Then high glycemic index foods like gluten and white rice, and minimal eating. Okay, so this is not another counterintuitive. You have a problem and you want to eat more.
Yeah.
So when you eat more, your body has to process, do a lot of activity to digest that food. Whether it is good or bad, it's a different story, but at least a lot of activity has to happen. Now if you don't eat, or eat less, or eat in the form which is easily absorbable, then the recovery will be much faster.
Absolutely. And when it comes to nuts, because nuts are again considered healthy, but are there any nuts that has to be avoided, like which could be high on glycemic index, or is there any form of eating that should be considered in mind while they are consuming it? Any thoughts on that?
So nuts, I think generally they're no problem. Make sure you soak them. Soaking
Okay.
is important. Otherwise, they can cause allergies, and allergies can trigger more inflammation and thereby more problems. So you soak them overnight. The first meal of the day should be heavy meal. Should be a rich meal. Should be king size meal. Not in terms of the volumes, but in terms of the intensity or density of the meal. you have more fats and proteins. Now, you can have soaked nuts and seeds, blend them into the water or coconut water and or coconut milk and drink. So that can be rich meal. Evening meal should be early, 6:30, 7 o'clock. But I don't think there's any restriction on any specific nut per se. But make sure they're soaked.
Alright, perfect. Thank you so much, sir. I guess you answered most of the commonly asked questions that patients have. Um, at parting ways, any advice that you would like to give to people who are watching this video suffering from facial paralysis and how they can reach out to you?
I think my website is functionalmedicine.in, clinic.in. So they can, or probably Ashwani Garg is my name. So they can Google and they'll find me. Uh, I think the first thing, the most critical part is to recover from any brain injury, or to prevent that any injury, you get enough sunlight. Morning, you get up, as the sun is rising, you go see the sun. You look into the sun, probably at an angle so that you don't damage your eyes. But sunning is very important. Okay, you expose your body as much as you can. Daytime, don't use any. I'm sitting without lights, so don't use any tube light LED lights. Reduce your screen time, reduce your Wi-Fi, reduce your cellular networks. Sleep at time. 10 o'clock, you go to sleep and make it pitch dark. And this is the most optimal way to recovery of the mitochondria, thereby recovery of the nervous system. So if you follow this, the rest of the things, easily you can do it. Second, the most important is the hydration. 80% of the body is simply water, and we don't think that water is so important for us. We just think it is for thirst, but it is a lot of for a cellular health is very important. So uh, I think we call it sun charged water. Just take your RO water, because you need to have a clean water. Keep it under sun for 3 hours, at least 3 hours. You can keep it longer also. Then drink this water which is kept in the sun. This will absorb infrared light from the sun, and this will give electrons to the mitochondria, thereby recovery becomes much faster.
Awesome. Thank you so much, sir. Thank you guys for being patient and asking your questions. If you have any further questions for Dr. Ashwini, please share it in the comment section. We would love to connect you to him, and I hope you guys can get maximum help from him in your recovery process. Thank you so much, sir, for being there, and looking forward to have more conversations like this with you.
Thank you
Thank
so
you.
much.
Yeah. All right.